Good morning and welcome to the program Perspectives on Invicta 98.9. This morning, we're still staying with COVID-19, where we have it in the world and what the world is doing about it. And we come back home to Nigeria. What are we doing here? And are the cases, on the increase? And come back, to Kaduna State where we are, and then talk about what is happening in the state. We do know that COVID-19 is a reality. It is here with us, and still, coming out with how to, find the vaccine for it. But again, we do know that what has come out of Russia is saying that there is a vaccine for for COVID-19, but the world is not really at ease or at home with this discovery from Russia, and of course saying that it has to go through all the what it has to be subjected to by World Health authorities, and so we're still not at home yet until the World Health Organization and other health organizations can tell us and confirm that yes, what is coming out of Russia is real. We do know in the newspapers today too and the news that the federal government has said that it has not imported any vaccine from Russia. So we are still not settled with COVID-19 and whether there is a discovery for the vaccine. But again, the world is watching, and of course, we're hoping that very soon, we all will be saved from this from COVID-19. But what do we have on ground? We do know that protocols have been put in place, that we all must observe these protocols, and that will keep us safe. And of course, this protocols for some people, they are tall orders like keeping your distance, and of course stop the bear hug, stop the hugging, and and of course washing your hands with the sanitizer and all of that, and of course wearing the face mask. These are all protocols that have been put in place to keep us safe from COVID-19. But again, we're talking about compliance now. Are we complying? Are we doing that? From observations, what we see all around us now is that people have just let off their guards. And of course, COVID-19 is still real. It is still real, and the figures are still rising. But again, we must continue to talk about it. This morning is a sponsored program by the Kaduna State Ministry of Health. COVID-19, we'll still be talking about the facts of COVID-19. And I have with me by phone, my guest this morning will be Dr. Clara Ejembi. Dr. Clara Ejembi is of the Community Medicine Department, Ahmadu Bello University, Zaria. She's also head of surveillance pillar of the COVID-19 here in Kaduna State. Dr. Clara Ejembi, good morning.
Yeah, good morning. How are you today?
Yeah, glad to have you on the show. Well, I just gave a background there about what the situation is. But the real issue that we'll be looking at are the facts on COVID-19, the reality of it, and how we are right now that we all have relaxed, the lockdown, and how we are going about COVID-19. We'll see that some people have just let off their guards on it. But again, the danger and what it can cost us if we do not stay with the protocols. Your thoughts on the background there?
Hello?
Hello, doctor, yes.
Yeah? What's the question?
Oh. You can hear me, doctor? You're getting me?
Yeah, okay.
Okay. So we're talking about the facts on COVID-19, the reality of it, and whether we are still, observing the protocols that have been put in place to keep us safe. What are your thoughts on what you're seeing around us now and the reality of COVID-19?
I think to begin with, COVID-19 is still, the pandemic is still raging. The number of cases are not coming down. And if anything, in Kaduna State, the number of local governments that reporting cases have increased significantly. Initially, we were just concentrating on about 9 LDAs. Now, all but 4 LDAs are reporting cases. We've had to expand the treatment centers, the testing laboratories. So we are not out of the woods yet. The epidemic is still on. Unfortunately, people have developed a nonchalant attitude, and when you go out, you don't see people observing all the protocols that have been put in place to mitigate the risk of transmission. Since they relaxed the lockdown and the courts were taken out of the roads, you hardly see people wearing face masks. People are not social distancing. They are not washing their hands. Markets are overcrowded. And people have simply gone back to business as usual. And it's very sad, because as long as we don't implement these protocols, our behavior will continue to place us at risk, and the epidemic will continue to rage. And I don't know how long that would be, how many years. There is still no vaccine, there is still no cure. It is our behavior that will determine whether we get back to normal life or we continue with COVID-19. Because the disease is associated with human behavior.
Yes, disease associated with human behavior. Now, doctor, are we not all at risk of what may happen to all of us? I mean, when we talk about, behaviors, some people would do the right thing, and some people would behavioral patterns of all of us. Some people want to stay with what ought to be done. Again, we have find deviants too who would want to do it otherwise. So, are we not all in the risk of this pandemic, just going round?
We are all at risk. My behavior will impact on me, I will impact on people around me. If I wear a face mask, it shows that I care about you and I don't want my droplets to infect you. If you wear a face mask, you are caring about me. If we social distance, we reduce the risk of our droplets getting to each other. If we don't shake hands, we ensure that our contaminated hands will not be the vehicle of transmission of the virus. So as long as some people are doing, some people are not doing, we are all at risk. It is when a large proportion of the population are adopting the behaviors that will mitigate the risk of transmission that we will begin to see that the epidemic is aborted. So we need to take responsibilities. I take responsibility for myself, and I should take responsibility for other people. You do the same, and when many people are doing it, we'll begin to interrupt transmission.
Is this a campaign that should affect all facets of the society? I'm talking about government's involvement in it. From all indications, government has shown its own concern about taking care of its citizens by the lockdown that we had, and of course all the protocols, the campaigns going on the protocols that we must observe them. It has also gone into palliatives when it first started, and so much we've seen that government has done. But let's look at the other facets, facets of society. The school, the family, and all of that. Their responsibility in keeping us safe from COVID-19. Government has done its part. Now we're on our own, and then so where must the campaign again? Strong areas that you push for the campaign to go into.
I think the government has done a lot, as you rightly said. They've developed the protocols, they've set up a response structure, they've mobilized resources, they are supporting implementation. Government alone cannot do it. We need to also engage other critical stakeholders beyond government. Civil society organizations have a responsibility. They work directly in communities. They are closer to the heartbeat of the communities, and they've established relationships with communities. So maybe they'll be more better trusted in terms of messaging. We also need to work closely with traditional and religious leaders. They are very influential in their communities and constituencies, and they need to be able to at least influence their people to do the right things. We also need to work with other community structures like the World Development Committees. We've been trying to work with them, mobilize them so that they can at least get involved and develop plans of action on how they can continue to sensitize their communities and monitor implementation. Professional associations also need to come on board. Beyond the government, the private sector, a lot of patients go there. They need to get involved in this war against COVID-19. So it calls for participation of each and everybody, and we have defined roles that people can play. Development partners have all been involved in the response, and there's more that can be done. One area that I think we need greater support is the support of the local governments. Well, now in Kaduna State, a lot of the planning and implementation is driven from the center. Because of the expansion of the epidemic to all but 4 of the local governments, we're thinking of decentralization of the response and getting the local governments to take greater responsibility. So we need the chairman at least to demonstrate political commitment to provide the necessary leadership as the state government, deputy governor and her team are doing at state level, and to also commit resources, to support communication interventions in their areas, transportation of patients, people that have been found to be positive, and other areas of support as needful. So there's a lot that still can be done, and those ones are mainly beyond just government. Each and every one of us have a role to play, including you, the media, and I think you've been playing your own role.
I was going to come to that.
Putting it on the front border.
Yes, just to stay with the media, so much campaign, bombardment of the airwaves on COVID-19. The media would have been seen to have, been doing its job, and of course, other broadcast stations too have been up and doing there. But I just like to ask about, yes, with all of that, everybody knows about COVID-19. The little ones know about it, and but again, I'm talking about how we have just, just relaxed on what we need to do, what we have to do. About keeping COVID-19 away. Why is that nonchalant attitude in spite of the campaigns and so much, coming from government too? Why are we all just like, yes, just go about having business as usual?
I think there are quite a number of factors. Um, I'll just mention a few that anecdotal evidence. There's a feeling of invulnerability to the disease. It's quite high. People think it's not something that will affect them. It can affect other people, not them. So low risk perception. And there are also complaints that they've not seen real COVID-19 cases. So they want to see the kind of cases that they are seeing in America and all of those very severe cases. They don't see it. They have not seen the treatment centers. So they don't even believe that COVID-19 is still there. So all these things, and there is this mistrust. They don't trust government. So they think that government is just using the cover of COVID-19 to get money. And in spite of the campaign and in spite of the sensitization and communication interventions, when you talk with people on the streets, people in rural areas and all, these are the kind of things that come out. So yes, they have the information, but of course there's a long pathway between knowledge and behavior change.
Yeah, you talked about, I have to pick on that, the people don't trust government. Do you blame them for that? Or why is that? Why are we having that?
Well, I really don't know why the mistrust. Maybe it's because the government, have made perhaps promises in the past and they didn't quite fulfill them. Politicians come and make a lot of promises. Once they get the votes, that's the end of the story. So they don't believe government. Bottom line.
Yeah, and again, people wanting, to have testimonies or, see the reality of victims of COVID-19. We see that in other climes and advanced climes too. But again, back home, we don't see that. And of course, talking about, medicines that can be taken before, getting the COVID-19 team over. Why are we keeping all of this away from the people?
No, to begin with, it's not true that people are not coming out and speaking about their experiences. People are doing that. 2 weeks ago, I took a survivor to Freedom Radio. She got infected in the course of her work and infected 12 other people, 10 people from her house and 2 from the neighborhood. And by the grace of God, they all recovered. And she came to share her experience on the radio. And there are people that are willing to share their experiences. Right? Others are not coming out because of the stigma and discrimination that is very strongly associated with the disease. So people tend to even hide it.
Again, one would wonder, why would this be so in this part of the world? I mean, if in other climes, advanced climes, we see people coming out and even thanking God and thanking, health workers who have helped them in that situation. But here, you talked about stigma and discrimination. Would the life of people that would give testimonies be the same again after coming out to testify to, their
I
recovery.
mean, let me give you an example. The lady that I brought to testify, she said before the COVID-19, she ran an open door house. If her neighbors will come from 5 o'clock to knock on her door so that they can start fetching water in her house. So neighbors were always in and out. The moment she had this problem, everybody stopped coming. They didn't even come to greet her on her recovery. The few people that bothered, they just made phone calls. How are you? And so that's how they are living now, like pariahs in their own neighborhood. Similar thing, a colleague of mine in the same office had the same problem, and 4 of her children got infected. And she said, neighbors, just a few of them called, I hope you are fine, and nobody came. So if this is the attitude, if they are stigmatized and discriminated against, obviously you will not want to come and share testimony. So we need to address issues of stigma and discrimination. And I think the major problem is that reasons for the stigma is because there's a lot of ignorance. People really don't know much about the disease. And obviously, there's a lot of misconception associated with the disease. And of course, people, if what they don't know, you fear what you don't know. Will they get well? Will they get free? Will they recover? Will they die? What will happen? So we have to address all these issues of stigma and discrimination within the context of communication interventions. Until you address the issue of stigma and discrimination, and any disease where you have stigma and discrimination, whether it's HIV, whether it is leprosy, whatever, it tends to drive the disease underground. People will not come out to testify that they have the disease. And even when they have the symptoms, they may not go for treatment early. So it delays care seeking. And when eventually they go for treatment, the disease may have advanced and the outcome will be worse than if they had gone early. And if you drive a disease underground, it continues to spread. So issues of stigma and discrimination, we need to deal with it. Issues of ignorance, we need to deal with it. Issues of low risk perception, we need to deal with it. And obviously, all these things that we are talking about, drugs and whatever it is, made available. Up to this point, there is no drug that has been found to be a cure for the disease. And there is no vaccine yet in the market. So there is no cure, there is no vaccine. Whatever drugs they are given are palliatives to address symptoms and to reduce severity of disease.
Okay, Dr. Clara, we'll have to go for a commercial break. I'll join you after this break.
Okay.
Welcome back. Here's the program Perspectives this morning, and we are talking about COVID-19 and what governments of the world are doing about it, and coming back home to Nigeria and back to Kaduna State, where we all are. My guest this morning by phone, Dr. Clara Ejembi, Community Medicine Department of Ahmadu Bello University, Zaria, also head of surveillance pillar of the COVID-19 in Kaduna State. Well, Doctor, just before we went on that break, you talked about not knowing much about the disease, people not knowing much about the disease. And since we're talking about facts of COVID-19, I'd like for you to highlight, things or facts to know about the COVID-19. Hello, Doctor.
I'm hearing you.
Okay.
So, yeah,
Okay.
facts about COVID-19.
Yes.
So, basic facts in terms of absolute numbers. Since the first case of the disease reported in December in China, we've had a total of about 20 million cases so far globally, with about 7 million deaths. In Nigeria, we've had 46,000 cases. Kaduna State, we've had about 1,600 cases so far. And obviously, there's hardly any country now that we are not having cases of the disease. And we all know the method of transmission of the disease. So it's just like it's caused by the same group of viruses that cause the common cold, except of course, and flu, except of course, this one is more infectious, it spreads more rapidly, and it is more severe. So it is a droplet infection, so it's by coughing, sneezing that the disease is transmitted. And since it's a droplet infection, it means that you have to be within close proximity to the person coughing or sneezing to get infected, so within 2 meters. We've also said it can be transmitted through contamination of your hands. So if you sneeze into your hands, or the droplet surfaces your telephone, your computer, your table, your chairs, your doorknob, and you put your hands and touch your face, then you can get the infection. If you have sneezed into your hands, you shake other people, you can transmit the infection. And whereas the epidemiology is very clear, the incubation period, that's the period between the time of infection and the time you begin to manifest symptoms, is between 2 to 14 days, with an average of 5 days. Okay? And as we are all aware, 80% of the infection is very mild or asymptomatic. So you may not even know that you have the infection, but you can be spreading the infection. Another 15% may be moderate infection. So it's just about 5% of the infection that is quite severe, that might require, intensive management in the hospital. And severe illness is associated with age. So older people that have comorbidities like diabetes, hypertension, heart disease, kidney disease, diseases that compromise the immune system like cancers and HIV, AIDS, those kind of diseases. So this, and in this environment, especially tuberculosis, is also an important comorbidity. And, and people that live in poor, overcrowded environments are at higher risk of infection. So these are the comorbidities, and these comorbidities are also associated with older age groups because they are chronic infections.
Yeah, and what about, we've also had that little ones too should be kept away. Of course, let me tie down with the World Breastfeeding Week that we had. That we were concerned about mothers to the child too here, and of course little children here. Why we must also keep them away or safe from COVID-19.
Yes, obviously, previously they thought children do not get the infection. But it is evident that the disease is also seen in children. The manifestation of the disease may be different. So it's important that we keep the children away. Obviously, these tiny children, you cannot ask them to use face mask. But even if the mother is infected, she has to ensure that she breastfeeds her child. Because the consequences of failing to breastfeed is worse than a COVID-19 woman breastfeeding a child. But of course, we need to keep them away from infection. So we know all of these things, The symptoms we are all familiar with, the common ones: fever or cough, associated with other chest pain, diarrhea, body pain, loss of taste and smell, those kind of issues. And as we all know, the only way you can confirm that somebody has the disease is if the person is tested. So even if you have symptoms, you have history of travel, you are only a suspected case. We can only confirm the case if samples are taken and are tested in accredited labs. Currently, I think we have 3 or 4 labs that are doing the testing in Kaduna State. And of course, once you are infected, the measures is to ensure that you isolate. So you identify, you isolate, you treat, and then you trace the contacts, because it's very important that you identify the close contacts of that person and quarantine them and test them, at least keep them for 14 days till you are confirmed that they are not infected before you let them go. For the people that have the disease, you must isolate them. And so isolation is key. Other things are supportive treatment. For what we need to do to prevent infection, the government in Kaduna State has, in this phase of the campaign, come up with an acronym that articulates all that we need to do, and the acronym is FORWARD. So you try to move forward and take responsibility to do the following. So the F for forward is face mask. Wear your face mask when in public. The face mask is your shield against infection. It protects other people, it also protects you. Always wear your face mask. O is to observe social distancing. Maintain at least 6 feet or 2 meters between you and other people. R is respiratory hygiene. Ensure that you practice respiratory etiquette. So cough or sneeze into your bent elbow or use tissue and dispose of it appropriately. W stands for washing your hands. Wash your hands always with soap and running water. In the absence of that, use alcohol-based hand sanitizer. A for the forward means avoid large gatherings. So no market, no ceremonies, wedding ceremonies, parties, naming ceremonies, the large gatherings, anywhere. Avoid it. R is to remain indoors. So remain indoors to reduce your risk of getting in contact with the virus. Remain indoors, and while indoors, exercise. So when you are remaining indoors, limit visits by people and stop visitation all over the place. So as much as possible, remain indoors. And the final thing is diet. Diet is also key. It protects you from infection and it also heals you. So this is the acronym for this phase of the campaign. Let's all pledge to move forward as we responsibly fight the pandemic.
Well, again, Doctor, you talked about moderate and severe, cases of it, and of course, the severe cases are, when it may just be beyond, control or salvage as it is. But are we having a situation where we're sometimes treating some of these infections, we find them moderate, that have not shown face, have not been severe, and so we just maybe sitting at home or with our hospitals treating all these moderate, things that come to us. Are we seeing a situation like that?
The moderate ones and the asymptomatic ones, we still need to isolate them. So as long as you are found to be positive, the whole mark of the management is to start with isolation. So if you are mild, the option is either to self-isolate at home or in a health facility. But obviously, before the case management team will allow you to isolate at home, people have to go, health workers have to go to your home environment to inspect the environment and confirm that it is feasible for you to self-isolate at home. If you have a one-room house and you are 6 or 10, obviously it's infeasible to even suggest that somebody stays there to self-isolate. So that means that that person must be taken to the isolation center. So everybody that is positive is either to self-isolate at home, depending on the home environment, or they are all taken to the health facility, isolation centers. But what we've seen increasingly is that some communities now, when you give them back their test result and tell them they are positive, they will deny, they will become aggressive, they will run away, that they don't have symptoms. It's just a lie, it's not their result. So there are increasing cases of denial that we've had to deal with. Some of them, the state government has had to, the Ministry of Health, report to the police and for them to go and see whether they can intervene and forcefully bring them to the isolation center. Because as long as you allow them, even if they are asymptomatic, no symptoms, to be moving around in the community, they'll continue to spread it.
Again, doctor, do we have a situation on our hands the world over? I'm talking about, in America today, now that Joe Biden, representing the Democrats, have chosen her, VP, and so the campaigns are in earnest now about who becomes the president of America, in months to come. And then back home in Nigeria, we also know that the campaigns in some areas, Edo State, and of course, Ondo State will shortly be going in, for elections of who becomes the governor of the state. And we've seen some areas too where campaigns are on, and we're talking about example by leadership. And so when we see leadership, disobeying all the protocols that have been put in place for COVID-19, you begin to wonder again too what the situation of the followers would be when they see their leaders. Back home in Kaduna, we've talked about security agents not observing the rules there, and of course, so people are asking and people are talking about what is leadership showing to followership.
Yeah, if we can borrow the from America, we can see what lack of leadership has cost America. I mean, instead of being a global leader now, nobody is talking about America. They've had the brunt of the epidemic. More than a quarter of the cases, 1,000 people are dying every day, just because you have a leader that is clueless, as far as I'm concerned. A leader that does not work with science. A leader that disobeys every protocol that is put in place to try to mitigate the risk of transmission. And it is because of poor leadership that they did not even have a national plan, a comprehensive plan to address the response. And if we begin to have leaders that want us to do as they say, not as they do, then obviously if our leaders are not leading aright, they are not walking the talk, then you don't expect the followership to obey. So our leaders should set examples. They should be leaders by example. But unfortunately, our governors, our people at federal level, all sorts of, you see them, doing all sorts of things, and you begin to wonder. It's unfortunate. It's unfortunate.
Okay, let's just
So
share
part
this
of the
conversation.
crisis is poor leadership.
Okay, Doctor, let's share this conversation with the audience too, and we'll bring them in. Just stay on the line on these numbers: 081 40,000 989, 081 40,000 989, or 070 87 800 989, 070 87 800 989. And these are numbers to call to be part of this program. COVID-19, its reality, and of course facts that the doctor has given about it. What's the situation in your area, and how are you coping with the pandemic? Hello, good morning.
Hello, good morning, Tony.
Good morning.
How are you?
I'm good.
Mr. Luka talking from Marabarido.
Okay, Mr. Luka, let's hear yours. Let's hear you.
The issue of this COVID-19 is like it's being treated with kid gloves in this country. You see, if you look at other countries, the way they are doing their things, we need to look at what is happening in this country is the reverse. Because how many people actually have been given this palliative in this country? Personally, I've seen a palliative on the screen. I've never seen it physically. And that is why a lot of people, because of hungry, they go out, and that's why they do not observe these protocols. So I'm of the opinion that actually the government should sit up and see that actually the masses are being given this palliative so that people would now begin to observe the protocol of this COVID-19.
Okay.
I had a friend who told me, I think it was yesterday, that he had better died of COVID-19 than to die of hunger. So I think we need to look at, if we are spending a lot of money for other things like this Boko Haram and all whatnot, I think this pandemic is a third world war. At least we should not handle it with gloves. The government should sit up. That's my take this morning.
Okay, Mr. Lucas, we got you on that. Still, we'll take one or two calls before we come back to our guest. Hello, good morning.
Good morning, Mr. Allen.
Good morning.
Thank you, guest. You are to Engineer Manuel.
Engineer Emmanuel.
Our guest has spoken well, and she told the government in a way that not to be compared with other countries. You see, now there is a rumor, because I know there is no smoke. Smoke will come out there, fire will be used to spring off. They want to the vaccine, the federal government are denying it. Just the same thing, the issue of this other country that send their COVID-19 drugs to us. In the first instance, Madagascar. The first instance, the government denied it. Later on, the drugs arrived and millions of euros was paid. And up till now, they have not used that drugs to test anybody.
So what is your point, Engineer Emmanuel? Your point here.
Yeah?
Your point. What is your point?
Okay, my point here. If Nigeria government are really ready to tackle this issue called COVID-19, because we keep hearing figures that they have now, just yesterday, Tech approved 8.something billion for test of COVID-19. For God's sake, so where is all the money that they have been donating for COVID-19? Where is this money? And now they are releasing some money for tests. Up to now, in my community, I have not seen the test. Chocolates of palliative. So please, chocolates of ill face mask that is common, that is, the government makes it available. Now, children will still resume back to school. Go to those schools now. There is no wash and something. What have they put in place that these children will go back to school? Okay,
Engineer Emmanuel, time. We got your point on that. Let me just add one to it before I come to Dr. Ejembi. Hello, good morning.
Good morning, Mr. Taylor.
Good morning.
Good morning to your doctor. She's from Mutokobun is on the line.
Yes.
Mr. Taylor, I'm always angry whenever I hear all this our government, people that are benefiting from government, telling us all these kind of stories. I'm totally angry. If you look to this doctor's house now, everything is in place. She's comfortable in just working in government.
Anything wrong with that, Chief Amotekun? Is anything wrong with that?
I'm not be angry. Yes, you see, based on what you said, the government has done a lot. What has the government done for the people? Mr. Tayalabi, if you go to Italy, probably you see that the Italian government has been providing hand sanitizer all over the street. If you have the capacity in Nigeria to do it, if you have the capacity in Kaduna State to do it, you can believe me that the coming legislation that government told us that they are going to provide nose mask by doing it in a place. Mr. Tayalabi, the fund they give for that has been swallowing the money. As well, many of us don't trust the government. They will still watch this money in the afternoon, you will see black. It's very unfortunate.
Okay, all right.
We take the government.
Okay.
Now, because the Nigeria, as you said, that is increasing. Yes, it's increasing. But I haven't seen any of them in the central market as the infected. We didn't see anyone in the Monday market. The people from the Monday market that this person has been infected in the market. Let the government allow the people to. Because the 19 will keep talking. But the insecurity has seen a lot more than the COVID-19.
Okay, I got you on that. Well, we just have to. Yeah, okay. Thank you, Chief Amotekun. Dr. Ejembi.
Yes, sir.
You got the callers.
The first one was on palliatives. We are not serious.
Yes, saying that.
The second one, they don't know what they are using the money for.
Yes, that.
Then the third one, I didn't get what he was saying.
Trust. How can they trust government? Yeah, the government has not really shown why the people should trust them. They say what in the morning, and then in the afternoon or night time they say another what.
Yeah, I think for the first point, obviously there are many problems in the country. Number one problem in the country, we cannot compare ourselves to countries like America, where all the citizens are documented, where you have a social security system, and in the event of anything, they can respond. Here, we don't even know how many we are. We can't identify ourselves. We don't have a social security system in place. So it's difficult to even plan and implement anything. And if you don't have a social security system in place and you don't have the numbers, you can't identify the people, it's difficult for any form of accountability set when they are making distribution of palliatives. And so till we begin to go to the fundamentals and get systems and structures in place in this country, we'll continue to have problems. That's number one. Number two, so we don't have social security, we don't, number two, we don't know who we are and how many are we and where we are. Number two, most of us, about 80% of people are engaged in the informal sector. So if you are engaged in the informal sector, it's not linked to government. And so the shocks, when you do lockdown and whatever, stay at home, your means of livelihood, is cut off because you are just living from hand to mouth. You go to find the money that you buy the food in the evening. And so all of these are not even captured in the systems of government. And so the palliatives now, I'm not sure how it is being distributed, but they say they did a mapping of poor households and they tried to distribute it. But obviously, no matter the good intentions of government, the good intentions get sabotaged along the way. Because I've had to discuss with a number of people that they went to their Angua, and then I've had to talk with the deputy governor, where she tells you what they listed for everybody to get, and what they were giving people, you'll just be laughing. So where was the diversion and who diverted? So even the people that are given the things to distribute will divert, Some of them now will now go and turn it to their party pet foods and give. And unfortunately, even the palliatives are grossly inadequate, to even go around. But they get diverted. So till we put our systems in place, we'll continue to have this kind of problem. The second issue revolves around funding, and they don't know what government is doing with the money. Honestly, if I have not participated and submerged myself as a volunteer in this epidemic, I would have been talking like any of them. But now that I have been there and I see the money and what it's being used for every day, I begin to wonder the level of commitment of government that they are able to mobilize this money and do all of these things. We were asked to cost how much it takes to just treat one patient. From the time you have to go to the village to go and investigate, take sample, carry the sample to the lab, go and do contact tracing of all his contacts, carry the person to isolation treatment center, give him food, bed, get all the doctors, do all the investigations, do whatever. Honestly, it came to 450,000. All the workers that are seeing the patients, they wear what you call N95 face mask. All the people involved in the epidemic, and they are in hundreds. Each of these masks costs 5,000 naira, and you cannot use it more than once a day. You do it a day, you throw it. And think of all the personal protective equipment that are being used and are being distributed. The drugs that they are being given, they don't pay for it. The transportation that will go up and down the villages, sometimes one person, you have about 100 contacts, and you have to go and trace all of them and interview them. It costs money. You have to man all the point of entries and examine them, keep records of all they are doing. We have 9 pillars: the laboratory, the case management people, the people that are doing risk communication. They have to go to every committee, every LDA to do activities. It costs money. And they must have personal protective equipment. The health workers that are keeping your facilities open, you must give them personal protective equipment that they will use. And all of these are translating to millions of, hundreds of millions of naira that are extra budgetary. They are not part of the budget. The government has to find the money to do that. So yes, you'll be concerned. You heard about money, you don't see it. But these are the things that are the cost drivers of the epidemic response.
Okay, Dr. Ejembi, that would just be about the more that we can take on this program. I'd like to thank you so very much for coming on the program and the enlightenment and information that we've gotten through you. Thank you for being part of this program this morning.
So thank you very much. Okay.
And that has been the program Perspectives this morning with Dr. Clara Ejembi, my guest, a community medicine department of Ahmadu Bello University Zaria and head of surveillance pillar of the COVID-19 in Kaduna State. Of course, keep getting information and stay with the protocols that are on ground. And of course, we keep saying stay safe, stay alive. We all, have to do that. Highness, thank you for connecting us with the people this morning. And Wisdom, thank you for putting us in the pictures. We'll come back with Perspective tomorrow. Good morning.
Invicta.